Hi everyone, I'm Dr. Iman Thalia and I'm a skin doctor and aesthetic physician. So I mainly deal with patients with skin issues or anyone who wants cosmetic enhancement. A little brief history of where I've been. I've worked in government before and I did emergency medicine and then I went into dermatology after that. And then I think that's where it sparked the interest of getting into aesthetics and dermatology. This is a common question I get from my practice, and I see a lot of patients, clients suffering from a lot of acne problem and blackheads, cystic blackheads and things like this. And I would say, like, regardless of your skin type, you would have to exfoliate. It's something that I always emphasize during my consultations, or just, it's something very, very important. You have to exfoliate. And if you have congested, oily skin, I would say maybe twice a week. And I usually tell my patients to actually designate days where you would do it. So, for example, Monday and Thursday. Because if you don't designate a day, then you probably would just forget about it. If you just say, okay, twice a week, and sometimes you just forget. But if you say Monday and Thursday, then there would be some consistency there. And so regular exfoliation is also very important to promote healthy skin turnover, and then getting rid of the dead skin cells, and also helps in like when you're using other skincare products like serums or other types of vitamin C or retinol and things like that. So you would want those products to actually absorb or penetrate better, and that would be together with exfoliation, I would say. Usually I would recommend salicylic acid, any products with salicylic acid, and even glycolic acid as well, combination sometimes, and even retinol as well, like, because comedonal acne works best with retinol. Just really great for like brightening and protecting the skin, nourishing the skin, and it's just a wonderful antioxidant. So she says she has combination skin, right? Yeah. So it's, despite its wonderful properties and it's an antioxidant, but not everyone can gain the same benefits from vitamin C. Sometimes it can aggravate certain skin types, like for example dry sensitive skin types. And I've seen a lot of my patients who actually can't tolerate vitamin C because they have very sensitive skin. So I would say she can try, definitely she can try some vitamin C serums out there. There are many actually that are well known. So yeah, but for people who have sensitive skin, another good skincare product would be anything that has niacinamide, which has vitamin B3. It's sort of like a vitamin C alternative. And I would just say it's just as good as vitamin C, and it also helps with dark spots. And it's also like an anti-aging product as well, helping regenerate collagen. But it's sort of like a trial and error sometimes, right? Like when it comes to skincare products, some might work for you and some won't. It's unfortunately, even for me as well. I have to like research a lot of skincare products for my skin. Sometimes what happens is that if it's a cystic acne, it usually, it's a pimple that is very deep inside. It's an inflammatory acne. It usually doesn't have a head. You've got acne, and then you've got like cystic acne that actually need to take medications, antibiotics or retinoids, because even if you use any products, it would be something that has to work well deep inside the skin, to get rid of that. So it's like, sometimes there's like overproduction of sebum causing the raised skin around the area as well. So that's why it keeps occurring at the same spot. And then, you might want to look into products that has like benzoyl peroxide or, glycolic acid, salicylic acid, as treatment spot. But if it's just a one pimple, then that should be okay. If it's more than that, then maybe it's something to look into. And so another interesting thing is like, like period acne, hormonal acne, it usually occurs at the same spot, like chin, jawline. Yeah, so those are like called the hormonal belt. And so yeah, so due to overproduction of androgen, a hormone that actually, overproduces, actually secretes it from the sebaceous gland. And so that would cause an acne at the same place, yeah, repeatedly. I actually need a bit more detail in that question, like where exactly the blemishes are happening, and then what type of blemishes are they? Is it inflammatory acne or non-inflammatory acne? Is it comedones? If it's like it's a general acne problem or issue, I would say maybe it can be many things actually. Is it, genetics, hormones, stress, and then, it can also be skin products. Sometimes you're using the wrong skin products that can also, lead to blemishes. So I would actually ask a few more questions for me to be able to know is actually causing her blemishes. Most of the women that I see in my practice are usually, 30s and above, and in their 40s and 50s even. So I love suggesting vitamin C serum, high potency vitamin C serum, which is like 15% to 25% even. Maybe to use a lower percentage first and then step up, because as I mentioned earlier that, it can still irritate some skin. And so why vitamin C? It's because, it helps with brightening dark spots, helps with increasing collagen, firms up the skin. And because when you're in your 40s, you tend to get a lot of age spots, pigmentation, and then, your skin texture becomes a bit lax, so you get that looseness of the skin as well. So you use vitamin C to help firm up your skin as well, Also, it's great as a UV protector, so it acts sort of like a veil. So it's great to be used with your sunscreen, which is also an important thing that I would recommend my patients who are in their 40s. And another thing I would say, because when you have mature skin, it tends to become a bit dull. Okay, so and thicken. It thickens as well. So then exfoliation is also great. So something like I would combine having like a physical exfoliator and a chemical exfoliator. So that means like physical exfoliation can be any product, scrub, like like exfoliation beads and things like this. And then chemical exfoliation would be any products that has AHA and BHA, because there are numerous studies to show that women who actually use skincare products that have AHA, BHA actually age much less. So they have less fine lines and wrinkles, and they look more youthful. So it's definitely something to have in her skincare. Another one, last but not least, retinol. I'm sure you've heard about retinol. It's you can even start it as early as your 20s and 30s. I started using it when I was 30 as well. Yeah, so it helps. It does wonderful things and helping with fine lines, wrinkles, and aging spots as well, and also collagenesis. When buying skin products, so two most important things I would say to consider, apart from looking or studying at the active ingredients, would be the expiry date and the period after opening, which is called PAO. And so when it comes to expiry date, it means that it's the end of the life of the product. The end life of the product. Basically, it's like food. It has an expiry, regardless of whether you open it or you use it or not. If it's 2 years, then the expiry date will be 2 years. And on the other hand, PAO, which is a period after opening, would tell you how long you should keep a product once it's open. So this is indicated on skincare bottles as like 6M, 12M. So these are the two important things to look out for. And if these two dates are up, it's just safe to toss your skin products away, unfortunately. And so that's the thing. Sometimes we, tend to buy a lot because of, the price is great at the time, or there's sales and things like that. But when, the expiry date just ends, and it's time to not use that skin product anymore, because it can irritate your skin, because that there are active ingredients in there. So once it's expired, it definitely can irritate your skin. This is a bit tricky because I would definitely have to inspect the rash because there are like 1,000 different rashes, and it can be caused by 1,000 different things actually. And history would be very crucial for me to actually know the proper diagnosis here. In general, I think like neck rashes, I would probably look into like maybe the necklaces, like is she wearing some necklaces, and do you have like allergy to nickel, gold, or silver, or it could also be eczema if it's even flaky, or dry. And then it could even be fungal, like seborrheic dermatitis or other, anti-inflammatory conditions or autoimmune diseases that can cause that. With dry skin acne, it's a bit tricky as well to treat, because you sort of want to treat the acne, or like she said, she's used water-based, oil-based, and things like this, but it's just aggravated her acne. I would say stay away from oil-based products, because that could just make the acne worse. I probably would add some spot treatments, like maybe salicylic acid or even lactic acid, because she has dry skin, because lactic acid would be good for dry skin. And even glycolic acid, but just a very low percentage first, and then build up to the higher percentage. Or I probably would also need to see what kind of skincare she is using at the moment. It could be her skincare as well, that is causing acne. And when it comes to supplements for the skin, I would actually recommend vitamin D. Vitamin D is good because there's a lot of research and clinical studies to say that it has actually helped reduce acne, and it's a powerful anti-inflammatory. It has powerful anti-inflammatory properties, and they've actually done a study, and it shows that 50% of the individual that they studied actually has a reduced level of vitamin D. Yeah, so when they treated them with vitamin D, and then they actually improve, and it definitely improves their acne. Yeah, so another thing would be, I like to prescribe probiotics for my acne patients. Yeah, so that's also very good. And biotin, zinc. Yeah, so those are like good skin supplements for acne, I would say. I started to notice that my skin was dry, dull, and so what I did was I did exfoliation, and then also using overnight mask, and then and products that I have with AHA, BHA. That's my favorite product, because it instantly brightens up your complexion.